You're listening to the Public Health Epidemiology Careers Podcast, episode 134.
Welcome to the Public Health Epidemiology Careers Podcast, where we explore public health epidemiology careers and share tips and strategies to help you enter or transition into the field. And now, your host, Dr. Charlotte Hughes Huntley.
Greetings, everyone, and thank you for joining me on this episode. In this episode, I'm going to share with you 3 big takeaways from the Expo that will demonstrate why this is a great public health career resource. I really want you to pay close attention to this because it was important enough that I felt that I should put this additional episode into the schedule. I was not planning to do a follow-up episode after we recorded the Expo, but this is important enough that I did create the space on the schedule to come in and share it with you. You know, it's one thing to talk about what we plan to do. It's something else after the event happens and to come back, retrospectively and discuss it. So I really want to go over these 3 big takeaways. Now, there were plenty, but I narrowed it down to 3. All of the presenters and I met and went over some of the details, wins, losses, what we'll do next, how we would change things, so forth. We went into a lot of detail. But I really talked to all the people involved. I talked to the presenters. I talked to some of them one-on-one about their takeaways. I talked to my team and I received feedback from people, attendees who were there live. And I just gathered all this information and just in my whole experience of being there all day. And it's really incredible. So let's start with the first one. And that simply is that the Expo far exceeded our goals and expectations, hands down. Now, our initial goals were to raise awareness of the work, the innovative work that our colleagues are doing to advance public health through their businesses. We wanted to raise awareness. We also wanted to be able to inspire innovation, people to start thinking about doing things differently, maybe approaching a public health problem a little differently, especially those who have ideas about maybe starting a business or doing things a little differently than the traditional path, or maybe just enhancing a traditional path. Those people had the ideas. We wanted to encourage action steps on those business ideas or those innovative ways and ideas. We also wanted to encourage collaboration and use of the services that my colleagues provide. So by raising awareness of how they are advancing public health through their consulting businesses, we want to encourage you to be able to collaborate with them, use those services, really think creatively. Those were our initial goals. Well, the Expo definitely met those and far exceeded those goals. So what we accomplished on top of that, on top of those goals that I've just described, those were met. But we also were able to accomplish this valuable resource to broaden the understanding of public health. The Expo itself is now a tool, a valuable resource to be used to help really give a deep practical understanding of what it means, not only just to be a consultant, but what it means to really practice public health. Some of these discussions and experiences that my colleagues shared through their presentations, they really hit home and they really gave a very full picture of what it's like to work in a setting for someone else, because we all worked somewhere else before we started our businesses. And what it looked like to transition into starting a business and creating services and networking and finding clients. And now this is not a how to become a consultant, but it's about inspiration. So when you are able to listen to 10 different presentations of 10 different businesses, you're talking about 10 different stories of people who moved into their business model from working somewhere else in public health. So that glimpse into what consulting looks like was really powerful, much more so than what we anticipated or expected. It was different to have everyone, every story, every presenter had their own hour. So we weren't just sharing one collective hour with everyone talking for a few minutes, but each presenter had their own space and their time on the stage to really go deep into it was all about them. And that made a huge difference. And I'm sure that was a huge factor in the whole power aspect of this, but it was very insightful. extremely. There was, like I said, a glimpse into what consulting looks like, and just a small glimpse, because if I had 100 consultants and they all share 100 stories, it would look 100 different ways. So it's so unique, but there's some things that are so similar across the board. The connection to the stories of the presenters, their passion for their work, it was clear. I mean, you could definitely feel it. You could hear it. It was incredible. And it's hard to even put into words, but it was a very powerful experience to be able to have such revelation. And like I said, that applied, seeing public health being applied in so many unique ways. It was just more powerful than anything that you'll read on a blog post or hear on a podcast episode. And the networking opportunity was just a notch above just an average networking opportunity, because once you have a chance to view the presentations, the people that were there that could interact live had an added layer. But just watching the recordings and hearing those stories and going through that, and then being able to connect with them on social media, the presenters that you were interested in, that you wanted to follow and connect with, that connection was a little deeper and it meant more. So it far exceeded our goals and expectations in such a great way that it's hard to not highlight that. And like I said, I tried to articulate this, but it's something that you really should experience for yourself. The second big takeaway is that there was just the generous nature of the presenters to provide the expo at such a low cost. We really agreed on this, and I touched on this in my description of the expo in a previous episode before it went live. We all wanted to have this be a low cost so that it would be available to people who really wanted to learn about consulting and experience it at just a low cost, keep it very affordable, basically being able to kind of cover the expense of the event and maintaining it and providing it the way that it's being provided. And for that reason, because we were able to do that in that generous nature, like I said, the cost being low, and they were very generous with pouring out their heart and their passion for what they do, just made it an incredible value. So there's not really many opportunities to get such a practical view of public health careers and such a practical sense of what it's like to be a consultant and working in public health in this way that's so unique. So this affordable nature of the expo, on top of the fact that it is so impactful and far exceeds our goals, makes it such a tremendous value. I cannot emphasize that enough. So if you purchased and enrolled in the expo early, but have not attended, please do so. If you have not, but you're interested now, then do it. It's very affordable. And the way I look at it is you could almost use it as a professional development tool. Or there are 10 presenters, which means there are 10 presentations. Decide to view one a week. And then maybe set aside some time once a week, and then you can just view one, take your own notes to have a chance to digest, or you can just binge over a weekend if you like, however you want to do that. But it's an incredible opportunity to take part of that. I'm really glad that we set up the platform the way that we did, that we provided the recording this year that we did not do last year. So because it was so incredibly powerful and just a rich experience, I'm really happy that we have it available, that I can even come back and tell you this was amazing. It was awesome. It far exceeded our expectations. And now you have an opportunity to still, enroll, and it's still an incredible price. So I really just appreciate the generous nature of the presenters, both in agreeing to keep this a low cost and the generous nature of them in providing such insightful glimpses into their businesses, into their experiences. And then my third big takeaway is the impact of just having presenters share what they do and their why, and to demonstrate their businesses was much more powerful than expected. And I alluded to that as I talked about the other two takeaways, but it is a big takeaway all by itself. Let me explain what I mean. So I have a support team in my business, and there are core members of my team that are involved in the day-to-day aspects of what it takes to run my business. And they don't necessarily have, none of them actually have a public health degree. They have some understanding of public health on different levels, from just a little bit to, tiny bit, but maybe a little bit more, some just different levels of understanding of public health, but not a public health degree. So I have one member of my team who's relatively new. She was actually brought in to assist on the planning of the expo, organizing the content and the schedule with all of the presenters, a lot of the administrative duties behind organizing something like this and putting everything together and uploading those recordings when they were ready, and just a lot of those types of tasks. She was focused on just the expo, and she doesn't have a public health background. She was really interested in the whole project. She's health conscious and she's interested in health, but just not understanding really public health. So she helped with the project weeks, because we worked on this a couple of months before the actual expo started. A lot of behind the scenes here. But on the day of the expo, when we were live, I asked her to be with me on each of the presentations. Part of that was for the technical aspect, because you just don't really know what to expect. We did have a few technical hiccups here and there. That's going to happen. But overall, it was a very smooth day. But I asked her to be available as backup and to kind of help cover some of those technical aspects. So as a result, she was present in all of the presentations. She was there live. And she and I had already scheduled a follow-up for the next day, just to go over, the good, the bad, the ugly. We had just were planning to do that. And I was so surprised at her reaction. She said that it really helped her to understand public health. She had such aha moments throughout the whole day. She also realized that there was so much value in terms of the lessons that were learned, the messages that were shared are relatable into so many other industries beyond public health. And I knew this, but I stopped thinking about that. Really, I just didn't keep it in the forefront of my mind, but I knew that that was to be true. But to hear her reaction from someone who does not really understand public health, to then all of a sudden she's really fired up about public health and she really enjoyed it. She understood the importance of networking, because that was I think every presenter talked about the importance of networking, from either finding new clients or just all the connections. And she just talked about, just those relatable lessons learned. I had a different member of my team who is in health administration, health records, and she works in that side of health, medical records. And she had a pretty good understanding of public health. And she was able to attend one or two of the sessions live. And she's going back to watch the recordings of the others. But what she was able to grasp live and share feedback with me was pretty much very similar to Sarah's reaction. She was very excited. She was very surprised. She had a lot of sort of aha moments. And for her, it was a deeper dive. It was a deeper understanding of what she kind of had a good surface level understanding before. She got excited about some of the presentations that she attended. She was personally interested in some of the topics. So to the other members of my team, I have access to the recordings, but I haven't had a chance to sit down with them to see what they've been able to view and get that feedback. But I thought that was really interesting, especially for us who are always in public health. And we do have the understanding. For someone to come who doesn't really have a deep understanding of public health or has no public health degree and have this much excitement about the expo, think about how much more insightful and enlightening it is for those of you who are in school, you're students, or you have completed your degree, and to get that understanding. So I think one of the big things there is it points to, it doesn't matter if you're really looking to start a consulting business. I think attending the expo helps you get a real practical understanding, a deeper understanding of what public health is and how that looks, because it is so broad that it's hard for people to look outside of the 2 or 3 things that they typically think of when they think of public health. There's so much more to it. And reading it in a textbook is not the same as listening to someone who does it every single day. So this expo had a huge impact on people who are not even public health professionals or studying public health. So I think that was just important to note, because like I said, those of you who are studying public health, it will have even deeper or greater impact on you. Another thing is the feedback received from the attendees. So these are people who purchased the early bird enrollment, or maybe they purchased the day of, because a lot of people purchased the day of and joined us live on some of the sessions. But there were several surprises from the feedback from attendees. Now, this is really the feedback that was happening throughout the day. Because one surprise thing we noticed is that there were several people who attended all day long. They were at multiple sessions throughout the day live, which I didn't anticipate. I mean, I knew I would be there because I needed to be there for all the presentations. I knew that, Sarah would be there. That's part of my team that I asked her to attend all of them live. And even with the presenters, they were only there for their hour. Some of them came and attended some of the other lives, but I did not expect attendees outside of the presenters to be really hanging out all day, but it was such a nice experience because they were right there. I noticed there were familiar names going from session to session, but it was also nice because at one point there was in one of the sessions, someone made a comment about how nice it was to attend this sort of online conference and to be in the comfort of her own home. And she had her kids running around doing whatever they were doing in the background, but it made her feel she was at ease and she could focus on the sessions and take some notes. And she was just from the comfort of her own home. A lot of people who were off that day were able to join. They chose to spend their day with us in those sessions. And that conversation in the chat provided a little bit of bonding, an opportunity to get a deeper connection. That was just something I didn't expect, but it was a really nice thing that happened. And for those people who attended, it was especially nice for them. Now, of course, watching the recordings, you don't have the live interaction, but you do get to benefit from the engagement because all of that is recorded. I tried to be really good about reading the questions that were typed in so that as we responded, those who were watching the recording aren't just trying to figure out from the response what the question was. I try to repeat the questions out loud and so forth. So the recordings are intentionally done so that they are very helpful for all of you who watch the recordings. But those who attended live really made for great conversation. Their interaction and their engagement made for great conversation. That was one of the things that was a huge improvement over last year. Last year was just, I won't say chaos, but there were so many people and they were asking questions all over the place. This year was much more, it was a rich conversation. So that's a benefit of watching the recordings is the questions are very insightful and the discussions are very rich. So another bit of feedback from another attendee the comment was that they felt really encouraged and inspired. So that was just really an ongoing theme. At the end of each session, there were thank yous, lots of thank yous. And some people specifically said that they felt encouraged and, inspired to take action and to get started and really just felt a relief. Sometimes it was just a matter of connecting with different parts of our presenters' journeys that gave them peace of mind and some inspiration and just feeling encouraged to keep trying to keep going. So that was really nice to hear, to receive. And they often commented about the level of openness of the presenters and their willingness to share their businesses. And that was really a common comment that was received from people who attended live, that they just appreciated the level of openness. And again, as well as my team who did not have the public health background, the attendees who do have public health backgrounds, either students or graduates, they commented about having a much better understanding of what it means to be a consultant. Because I think sometimes that we use that loosely, but people don't really understand what it means. And also I can understand that it's confusing because consulting can look so many different ways. So those were some common kind of themes in the feedback, adding to this benefit and how powerful of a resource the Expo is. On top of all of that, we received several 5-star reviews, written reviews from people who attended the Expo live and attended some of the recordings, but they actually wrote reviews. And you can view those from the actual webpage for the Expo. But I'm not talking about 1 or 2 liners that just, that was great and rated 5 stars. I'm talking about paragraphs. The attendees actually took their time and they reciprocated our level of openness as presenters. The attendees really did that and shared with us why they liked it. They really opened up and shared more of how they had been feeling, their reasons for connecting and attending, and what they really gained from that. That was valuable not only to us as presenters, but I think it's going to be very valuable to all of you as you consider, maybe you didn't really think there was that much to this expo, or maybe you didn't fully understand what we were doing, or maybe you just didn't think it was going to be that big of a deal, you just weren't interested, but maybe now you're reconsidering. I mean, I really hope that you are. And reading those reviews may really help you decide that this is something that you want to invest in so that you can have that experience as well. I highly recommend it from, like I said, students, graduates, professionals of all levels. This is a great resource, not only for helping you understand public health on a deeper level, but just connecting with what's going on in the industry, seeing what our colleagues are doing and being able to support them. And then some of you who are more senior in your career, it may be a source of inspiration to think about what you can do and how you can level up and serve in a bigger way as well. So I encourage you to visit my website, drchuntley.com, click on the Expo tab from the main menu, and then you'll find out more about the Public Health Consulting and Entrepreneurship Expo. All right, everyone. Until next time, have a fantastic rest of your day.
Thank you for listening to the Public Health Epidemiology Careers Podcast at drchuntley.com.